Again, welcome to the town hall. Learn the facts about measles. This is a virtual town hall for School District of Philadelphia families and caregivers, presented by the Office of Student Health Services and the Philadelphia Department of Public Health. As mentioned before, my name is Dr. Kendra McDowell. I am the medical officer for the School District of Philadelphia. We wanted to have this town hall for you to answer your questions about measles and other vaccine preventable diseases. We know that the measles outbreak, we had a measles outbreak recently in Philadelphia, and luckily that outbreak has been declared over. Even though the outbreak has been declared over, we wanted to provide an opportunity with our experts from the Philadelphia Department of Public Health to get your questions answered, because we know this could be a scary experience. It may be, it's a new experience for some, and we want to make sure that our families have the information that they need to protect their students as they wish from measles and other vaccine preventable diseases. So I'm just providing information, interpretation, instruction information again for those that are joining. We have interpretation in Mandarin Chinese, Cantonese Chinese, Spanish, and Portuguese. So today, our town hall agenda, as mentioned, will provide an introduction, which I already gave, and then we're going to jump into it, hearing from our experts from the Philadelphia Department of Public Health, Dr. Shara Epstein, the medical director for the Division of Disease Control and Prevention at the Department of Public Health, will provide an overview of the measles outbreak in Philadelphia and what the health department did in collaboration with the school districts and other organizations to end the measles outbreak, which has now been declared over. We also are going to hear from Dr. Mesa Abu Ali, who's a specialist with the immunization program and is also a pediatric infectious disease specialist who works at the Philadelphia Department of Public Health. She will be discussing an overview of the measles vaccine and then just be talking about vaccine preventable diseases and immunizations in general. I will hand it off to you, Dr. Epstein.
Thank you, Dr. McDowell, and thank you all for having us here today. We're happy to be able to talk about our measles outbreak, which again is over. We're very happy to say, but required a lot of work and collaboration with everyone in the city. And we thought it would be good to give you a little bit more background about what happened, and then again talk about some about prevention. So we can go to the next slide. So this is our epi curve, what we call an epi curve. And this shows all the cases that we had in Philadelphia as part of our outbreak. And this graph kind of tells a story, and I'll kind of explain what happened here in Philadelphia with our outbreak. So you can see that blue bar at the beginning, that's a person that does not live in Philadelphia, but lives in a surrounding county, and had recently traveled abroad and presented to a hospital in Philadelphia. They were subsequently found out that they had measles, and the hospital did a great job notifying everyone who could have been associated or who could have been exposed to this person that they were exposed to measles, and gave great instructions about what to do next. And there's ways that we can prevent measles even after someone's been exposed. So they found out immediately and told all the patients and families in the neighboring rooms their options for preventing measles. Unfortunately, not everyone took them up on those options. And you can see by by the end of December, we have 2 more cases. So 2 more people developed measles. These people were a patient in a nearby room and that patient's adult family member, neither of whom were vaccinated and both of whom were eligible for vaccine. So those 2 people developed measles. And then you can see on 12/27 at the very end of December, a couple days before the end of December, a third person who was also exposed to that initial case in the hospital developed measles. That person did get what we call post-exposure prophylaxis. They were an infant, so too young to get vaccinated, but got an immunoglobulin, another post-exposure prophylaxis, and had a very, very mild course, did really, really well. Unfortunately, in the days following that, we found out some new information, and you may have seen it in the news, which is that the cases that were diagnosed on December 23rd had not been quarantining at home before they were diagnosed. And we found out that one of those cases had been attending daycare, and all the subsequent cases from 12/30 on were cases associated with that daycare exposure. So all the people that were not vaccinated in that daycare that were present on the day that the child was in daycare got measles. And I can say that none of the people that were vaccinated developed measles. So it touched, so every single person who was unvaccinated for measles developed measles, and none of the people who were vaccinated for measles at that daycare developed measles. The last case there on the end is a family member of one of the daycare cases. So that is and then since then, luckily, we haven't had any more cases. So since then, no more cases have come up. And I think we were lucky because even in these cases where the children in the daycare weren't vaccinated, a lot of their family members were, and that really helped us slow down the outbreak and really end it. Because you can imagine, had their family members been unvaccinated, their older siblings been unvaccinated, you would have started seeing cases at school. But that was not the case. I think a couple other important things that I want to say about this is that of the 8 Philadelphia cases, so of the 8 cases in orange, 6 of those people were hospitalized. So the hospitalization rate was extremely high. Almost everyone who developed measles was hospitalized, and some of them for really quite a long time. One of the 2 that wasn't hospitalized was that one that appropriately took their prophylaxis after they were exposed to the initial case. So that, like I said, that patient had a very mild course, but almost everyone else was hospitalized. And that just really shows what a dangerous disease this can be. Even when you think about, 40 years ago, 50 years ago, I guess 50 years ago, everyone got measles, but it's not the case anymore. And it can be a dangerous disease that causes hospitalization and even death. And I know Dr. Abwali will talk about that later. So we can move to the next slide now. And I just want to talk a little bit about all the things that we did to really keep this outbreak to a minimum. You may have heard about other very large outbreaks throughout the country in the past few years, but we did a lot of work. And again, we have a really great vaccination rate in Philly, and that helped. But we did a lot of work with Philadelphians and health, with the school district, with daycares to really keep this to a minimum. So you may all remember from COVID the words case investigation and contact tracing. Those are not specific to COVID. That's what we do with any infectious disease that we need to really contain. So our staff at the health department reached out to all those people who are exposed, found out about any of their contacts and were able to notify them that they should quarantine at home if they were unvaccinated. Vaccinated people were able to go about their lives as usual. There's really very little risk if you're vaccinated. But to keep those unvaccinated people home so that if they do develop disease, they won't spread it. We sent out messaging, and maybe some of you received it. We have in Philadelphia, we get reports of all vaccinations, so we were able to send out messaging to people, families of children aged 12 months to 6 years who we didn't have documentation of their measles, mumps, and rubella vaccination. And we were able to inform them that if they're not vaccinated, now's really a good time to go get vaccinated so that they don't contract measles during this outbreak. We were able to increase walk-in hours at some of our ambulatory health centers for vaccination. People were able to, of any age, are able to walk in to those health centers during the assigned times and get vaccinated. You don't need insurance. You just need, a piece of mail that says you're a Philadelphia resident. We also had several Saturdays of clinics. We know it's really hard to get out during the week, get your kid out of school. So we had several Saturdays of clinics to, again, ensure that everyone had opportunities to be vaccinated. We had a small walk-in clinic in the Northeast at Catholic Social Services. And we did this, we present to early childhood education directors throughout the city in both English and Spanish to make sure that they were able to encourage their families to get vaccinated. And then finally, our wonderful preparedness staff really canvassed neighborhoods and talked to families and daycares in areas close to the cases, again, to really encourage vaccination, and had some really wonderful conversations with families and daycares to make sure families really understood how important vaccination is. So with that, I'm going to turn things over to Dr. Abwali to talk a little bit more about measles vaccine and measles disease.
Good evening, everyone. Thanks for joining. So I'll be giving a general overview of measles disease and then of measles vaccination. I think what's important to remember is that even though the outbreak is over in Philadelphia, this can happen again. And I'll explain why in a few slides. So measles is a type of virus. It's an RNA virus. It's in the same family as the mumps virus. It starts out by a high fever, 103 to 105, followed by the 3 classic symptoms of cough, pink eye, and runny nose. And then the rash appears. Younger children can experience loss of appetite, and some children have Koplik spots, which is also classic for measles. They are red spots with white to blue centers inside the mouth. They're often missed because they appear about 48 hours before the rash and then disappear quickly within 12 hours to 72 hours. The symptoms of measles appear 7 to 21 days after exposure to the infected person, and we call that the incubation period. The rash starts 2 to 4 days after the symptoms start. It starts at the hairline and spreads down and out. It lasts 5 to 6 days and then peels. Next slide. So this is an example of how the measles rash can look like. As you can see, it's very intense. It's very widespread. It's made up of spots and pimples that can group together or coalesce. Next slide. And unfortunately, measles is a very dangerous disease. This is just a few of the measles complications that we commonly see. Pneumonia being the most severe one that can land children in the hospital because of trouble breathing, and that can occur in 1 to 20 children that are infected with measles. Diarrhea and ear infections are also common, occurring in about 1 to 10 children. Encephalitis is the scarier complication because it involves swelling of the brain, which can lead to seizures, blindness, and deafness, and that occurs in about 1 to 1,000. SSPE, or subacute sclerosing panencephalitis, is a kind of encephalitis that can occur 7 to 10 years after the initial infection. And it's more common in children that have been infected at age 2 years or younger. And as Dr. Epstein mentioned, hospitalization is common, with 1 out of 5 persons hospitalized with measles. And death can occur. For every 1,000 children who gets measles, 1 to 3 will die from it. And around the world, measles still causes more than 100,000 deaths, mostly in children. There is no specific treatment available, although vitamin A may help, especially in developing countries where children may have vitamin A deficiency. Next slide. So how does measles spread? It is currently the most contagious virus out there. And just to give you an idea, if 10 unvaccinated people are exposed, 9 will become infected. So 90% of people in the room. It spreads mainly through person-to-person transmission through contaminated air. So the infected person with measles will sneeze or cough or even talk, and their droplets will linger in the air up to 2 hours after they leave the area. And so people can inhale those droplets and become infected with measles. An infected person is also infectious and spreads the virus before the rash even appears, so they may not know that they have measles. Infected people are contagious for 4 days before the rash appears and for 4 days after the rash. Next slide. And before the measles vaccine became available in the US in 1963, there was an estimated 3 to 4 million cases per year of measles in the US alone, with 48,000 hospitalizations per year and about 500 deaths each year. Next slide. So the first live, attenuated, meaning weakened vaccine became available in the US in 1963. In 1971, a combination vaccine named MMR, short for measles, mumps, rubella, was licensed for use in the US. In 2005, a combination measles, mumps, rubella plus varicella or chickenpox vaccine named MMRV was licensed. In 1989 was when a second dose of MMR was recommended. And that's because the US was seeing a lot of measles cases in the late 80s, early 90s. So that second dose of MMR picks up the 5% of people who don't develop immunity or antibodies after the first dose of MMR. Next slide. So why is there an outbreak now? Measles was declared eliminated in the US in the year 2000. Elimination means no cases for 12 back-to-back months. But measles is occurring now in the US in 15 states. And that's due to pockets of under-vaccination combined with international travel, which can lead to outbreaks. Unfortunately, measles is still very common around the world, with a 45-fold increase in Europe alone. And it's still very common in the developing world, where the pandemic interrupted measles vaccination campaigns. So around the world, there's 22 million children that hadn't received their MMR 1 in the year 2022, and 11 million children that didn't receive MMR 2 in the year 2022 as well. Next. So the measles vaccine is safe and effective. Again, it's a weakened virus. It's preservative-free. It contains stabilizers, which are sugars or proteins that prevent the vaccine from breaking down during storage. It also includes neomycin, which is an antibiotic that prevents bacterial contamination. And the schedule in the US consists of the first dose, which is given at 12 to 15 months, followed by the second dose at 4 to 6 years before children enter school. Next slide. And the first dose can be given as early as 6 months prior to travel, but keep in mind that any dose given earlier than age 1 will not count towards the final series, and children will still need 2 doses. An early second dose can be given at age 1 to 3 years prior to travel, and that dose would count towards the final series. I urge everyone to check the CDC Travelers Health website prior to travel. All you have to do is Google CDC, travel, and your destination, for example, Italy. And it will list the vaccines that your child needs before travel, as well as any outbreaks that may be ongoing. Next slide. So MMR is a very effective vaccine. So antibodies, which are proteins that help us fight off infection, develop in 95% of children vaccinated at age 1 year or above. And after the second dose, close to 100% of children are immune and develop antibodies. And this vaccine offers lifelong protection after 2 doses. Next slide. So possible post-vaccine reactions. The side effects are more common after the first dose. Fever, which can occur after any vaccine, occurs in 5 to 15% of children receiving the MMR vaccine. Fever is not dangerous, it just means that your body's developed immunity after the vaccine. A mild rash, which is not contagious, can occur up to 12 days after the vaccine. 25% of adult women can develop temporary joint pain, which goes away. And a rare complication is a temporary drop in platelets. Platelets are the clotting factors in our blood, and that occurs in about 1 to 30,000 people. Febrile seizures, which are not uncommon in children, do occur after other viruses or other infections, can occur after the first dose of the vaccine. But they tend to be higher when the MMR-V combo vaccine is given as the first dose. So most pediatricians will separate MMR and varicella at age 1, using the MMR vaccine only for the second dose. Next slide. So who is considered protected or immune? So you're protected against measles if you were born before 1957, because that means you most likely had the disease. You've already had the measles disease, or you've received 2 doses of the MMR vaccine. Next slide. So the best way to protect our children and our communities is through vaccination. Because measles is so contagious, 95% of persons in the community need to be vaccinated to protect those too young to be vaccinated, or those with weak immune systems that are not allowed to receive live vaccines. When less than 95% of the community is vaccinated, vulnerable people are at risk. And so who's vulnerable? That includes infants, so less than a year of age, that are unvaccinated, those with weak immune systems like persons with cancer that are undergoing chemotherapy, and pregnant women. Next slide. So the Vaccines for Children program was enacted by Congress in 1993 to ensure that all children receive access to vaccinations. And it allows enrolled healthcare providers to give free immunizations to eligible children younger than 19 years of age. And those include uninsured, underinsured, and Medicaid eligible children. Currently, there are 201 providers in the Philadelphia area offering vaccinations through the VFC program. Next slide. In addition, the Philadelphia Department of Health Centers offer free vaccinations to any child, even if their pediatrician is not at one of the health centers. There are also additional MMR vaccination opportunities for both adults and children at the following health centers: Health Center 3, 4, and 5. Please refer to the PDPH website for updated information regarding these opportunities. And we are open for questions.
Thank you so much, Dr. Epstein and Dr. Abu Ali. If you have questions, please put them in the Q&A so we can get those questions answered for you. If you have any questions that you would like to discuss. Great. Well, thank you everyone for coming today and listening to and learning about the measles outbreak that occurred and that has been declared over, and welcoming our experts from the Philadelphia Department of Public Health. If you do have questions or want more information about vaccinations, please visit philasd.org/student health. You can also talk to your child's school nurse to get your questions answered about vaccinations. Have a great day. Thank you so much. Bye.